Assalamu alaikum, dear student. This is Dr. Ahsan Majeed. Today we discuss the lecture of the pharmacology, and this pharmacology discussion is totally lectures of MBBS, BDS, DPD, HND, and different allied health sciences fields. We know that today there is a different Medicare lectures on different topics, but I will discuss the pharmacology today. That's maybe the beta lecture, and that's maybe the different types of lecture over here. Today start the lecture that is very important, that is very interesting book, Pharmacology. That's in third year MBBS, Pharm-d and DPT, every student can learn the topic of the pharmacology, and I can discuss this topic in very easy way. So let us start the topic. The first is introduction of pharmacology. What is pharmacology? Pharmacology means in simple we can say the introduction. I can write over that. That is basically to study about the drugs. What is drugs? What is drugs? Drugs is drugs maybe it's maybe caffeine. Drugs maybe paracetamol. Drugs maybe different type of the drugs in the market right now. Whenever you can feel like pain in the and headache pain, and when you can feel of fatigue, then you can different medications, use the different medications here, like nimesulide and paracetamol, that having the salt, that is a acetaminophen. Today we'll discuss somehow what is a mechanism of action. So the first means pharmacology means that is a study about the drugs, and these drugs include example that one is a paracetamol and different type in the structure in the two names of the pharmacology, generic name and brand name. Generic name that is a acetaminophen, and brand name is paracetamol. Whenever you can move toward the pharmacies, and then you will say that you can pick over the paracetamol tablet and then can use the paracetamol. So that can totally act on this part, that is the brain, directly act on the brain CNS. That does not. It have the different mechanism of action. So the first is about definition, that branch of sciences deal with the study of two part, pharmacodynamics, kinetics. What is pharmacokinetics and what is pharmacodynamics? So the next is definition is that the study of drugs and effects of drugs on the body, response for the body. So the first of all, study of drug, that can earlier you can study over here. The second one is the effect of drug. What is the mechanism of action? How the drug acts on the body? What is the sign and symptoms? What is the indications? What is the general effect, side effect, adverse effect? What I can discuss with you later on that is a topic on the side effect and adverse effect. What is the difference between side effect and adverse effect? That is a very important, but student does not know about the basically what is a condition over here. So body response for the drugs, number one. Number two, after that we can discuss the next part, and this one is pharmacodynamics. What is pharmacodynamics? Pharmacodynamics is a branch of pharmacology that is concerned with the effects of drug. So pharmacodynamics, pharmaco means drugs, and dynamics means effects of drugs. So that's why easy way to learn, that is a easy understanding way, with effects of drugs and their MOA. What does this mean? That means mechanism of action, and that is the main part of pharmacology. Pharmacology mainly discuss all the medication mechanism of actions in the body, in the different structure, and definitely we can discuss the different structures in the pharmacology. So next one is a pharmacokinetics. What is pharmacokinetics? That is branch of pharmacology and deal with the movements of drug. That is a movements of drug. Like this one is a movement of drugs within the body. How the drug move, how the drug responds, how the drug can affect over here right now. So what is pharmacokinetics? That means what does body responds. So you know, dear students, you also know how the body responds, why they respond, what the reason behind him. That is the main reason over here. What does the body do the drug? So the next one is basically pharmacodynamics. What that does drug to the body. That's again you can, what does body response to the drug, what does that drug to the body, and mechanism of action to the body. That is basically a pharmacodynamics. So let us take an example, and that is a simple example over here. Right now I think so I just understand in my mind that is basically that simple mechanism of action. So that include ADME. ADME, that is a absorption, D means distribution, M metabolism, E means excretion. Absorption, distribution, metabolism, and after that the excretion. Detail in next lecture we will discuss in detail what is absorption, what is distribution, what is metabolism, and what is excretion. So this is the structure of acetaminophen and acetylcholine. That is a let us we discuss this how the pain we can kill the pain, a headache pain. The in cell membrane, that is basically a main structure is phospholipid with the help of enzyme phospholipase. Phospholipase, that is the A2 enzyme over here, and this can convert the 5 phospholipids into the arachidonic acid, and this arachidonic acid having the two enzyme COX-1 and COX-2. So it means we know that is a COX enzyme, oxygenase enzyme. So this can convert into the prostaglandins and thromboxanes. Prostaglandins and thromboxane, and both can produce a pain and fever, inflammation. So question is that if the patient is come over here and then can tell that the basically headache and fever condition, then you can prescribe the paracetamol PCM tablet. So what is the mechanism of action that can this paracetamol inhibit which enzyme that can inhibit the COX? If COX is inhibited, this is not converted into prostaglandin, and prostaglandin, if it's not working over here, if it is not produced here, then no pain and no fever and no inflammation over here. So this is a basic lecture of the pharmacology.